Is revision surgery covered by insurance? What to know? Revision surgery is an important topic for many who have undergone initial procedures. It refers to additional surgeries performed to correct or enhance the results of the first surgery. This could be due to complications, unsatisfactory outcomes, or functional issues. One key question many patients ask is whether revision surgery is covered by insurance. The answer largely depends on whether the surgery is considered medically necessary rather than purely cosmetic. Insurance coverage for revision surgery hinges on medical necessity. If the procedure addresses functional problems, pain, complications, or significant physical impairments caused by the initial surgery, it may be covered. For example, if someone needs revision breast reconstruction after a mastectomy, this is often covered. The reason is that it corrects issues like implant displacement or pain that can affect quality of life. To support insurance claims, documentation from your plastic surgeon explaining the medical reasons for the revision is crucial. On the other hand, purely cosmetic revision surgeries, which are done solely to improve appearance without any functional impairment, are generally not covered. For instance, if someone seeks a facelift revision just for aesthetic reasons, it is unlikely to be reimbursed. However, if the revision addresses functional problems, like impaired vision from droopy eyelids corrected by blepharoplasty, insurance coverage may be possible. There are also legal protections for certain procedures. In the United States, laws like the Women's Health and Cancer Rights Act requiring group health plans to cover breast reconstruction and related revision surgeries after mastectomy. This includes follow-up procedures done even years later to correct complications or improve outcomes. It's important to note that coverage can vary widely based on the type of insurance plan. For example, Medicare covers reconstructive revision surgery when it improves function or addresses injury, but not purely cosmetic revisions. TRICARE also covers medically necessary reconstructive surgery under specific conditions. When it comes to getting insurance coverage, thorough documentation is essential. Your plastic surgeon needs to detail the medical necessity of the revision surgery, including symptoms like pain or restricted movement linked to the surgical outcome. Many insurers requiring prior authorization before approving revision surgery. For patients navigating this process, there are practical steps to consider. First, discuss all functional and emotional issues related to your initial surgery with your plastic surgeon. Make sure these concerns are documented clearly to support your insurance claims. It's also wise to contact your insurance provider early to understand your coverage and any required approvals. Be prepared for possible out-of-pocket costs if the surgery is deemed cosmetic or only partially covered. In summary, revision surgery may be covered by insurance if it is medically necessary and not solely cosmetic. Coverage is more likely when the revision addresses complications, functional impairments, or reconstructive needs rather than aesthetic preferences alone. Working closely with your plastic surgeon and insurance company can help you navigate the documentation and authorization requirements effectively.